Hello, my name is Aral Sürmeli. I'm a medical doctor from Turkey, and I'm currently doing my MPH in Harvard THN School of Public Health. I'm also one of the project leads of HERA app project. I'm going to tell you about our innovation and also what we are doing to improve the health of Syrian refugees in Turkey. HERA app is designed and currently being implemented by MERAK, a registered Turkish NGO, which I currently serve as the vice president. The mobile app primarily aims to assist Syrian refugee women through their pregnancy and childcare by connecting them with the health services provided for them in Turkey. We founded MERAK in 2013 with the primary goal of providing medical assistance in disasters and also in humanitarian crises. We have been working with a lot of private donors, national and international NGOs such as International Medical Corps, Grand Challenges Canada, and also Harvard University. Since the refugee crisis started, it has been the biggest focus of MERAK's work because it is described as the biggest refugee crisis since World War II, and also it led to 3.7 million people fleeing to Turkey from Syria, which is the biggest Syrian refugee population in the world. We also know the health risks of being displaced, whether it is being a refugee or internally displaced people, is well established. They have higher risk of death or disability, even due to simple things such as hygiene, vaccine preventable diseases, or home deliveries. Fortunately, Turkey offers them health services free of charge. This is good because we have the supply side available for them. But we also know that in practice, access to healthcare has many obstacles, such as language, changing rules and regulations, or even the competing priorities. If you put yourself in the shoes of a Syrian refugee mother who recently arrived, she has to get registered, find translator, find healthcare services, and she probably doesn't have any income to do it. So we aim to fill this gap by linking the people who need the care with the supply there is. And we use the mobile technology to do this. Our innovation HERA is the first mobile app for Syrian refugees in Turkey. It primarily aims to increase the uptake of preventive health services. And we do this by sending push notifications, sending information, and also letting them know that they can upload or view their electronic medical records in the app. And it also can call 911 and repeat their location to the provider. The evidence for using mobile technology, whether it is SMS reminders, phone calls, or mobile apps, is growing stronger. And we know that they're very good at increasing demand side of the healthcare services. These type of interventions are also deemed highly cost-effective by WHO standards, and it's roughly $1,000 for a one quality-adjusted life year improved, which means a lot. We again use the mobile technology to monitor and evaluate the outcomes and the impacts. HERA automatically asks the user whether they actually went to the doctor and if they received the care they needed. And we believe that if it is scaled up in Turkey, HERA app will track 1.2 million refugees, the vaccination-aged children, and also reproductive-aged women, as they can use the app for other health problems too. This means hundreds of maternal, child, or newborn deaths averted. We are in a good position to undertake such a project because we have been working with Syrian community for a long time now, and especially designing and implementing health promotion programs in Istanbul or Syria bordering cities. Right now, we are at the midst of our proof of concept phase, which is being funded by Grand Challenges Canada. And right now, we started field trials, and we have been working with a lot of NGOs or the local authorities to be able to implement it in different Syrian refugee communities. But we are also looking for international partners too. So we hope that attending and presenting in Unite for Sites Global Health Conference will help us receive many feedbacks and draw from others' experiences and knowledge. More importantly, though, we believe conference will play a significant role in helping us in our efforts to scale